guys, it's Sarah here. In this video, I'm going to be going over the difference between ER nursing and ICU nursing. So let's get started. ER nurses and ICU nurses both take care of your critically ill patients. But there are major differences between the two nursings. In the ER, any type of patient comes in, your goal is to stabilize them and get them out of there. Whether that's admitting them or whether that's sending them home to follow up with their primary care, your goal is to stabilize them and get them out of there. We're not going to care that your feet are swollen. We're not going to care that you have a pressure ulcer. We're not going to care that your tooth hurts or you have a mark on your hand or anything else like that. We're literally treating while you're there, stabilizing you, and sending you up or out. In the ICU, they get this patient and they're basically fully wrapped in everything. They want to know everything about the patient. They want to know their med, when was the last time they ate, if they have any pressure ulcer. They want to know everything about a patient. And they treat the whole patient and try to treat why did they go hypotensive, treat that cause, and then so they get better and then they could be sent home or be downgraded to Tele 4 or whatever. So in the ER, you get any type of patient. You could get anywhere usually between 4 to 9 patients at a time, and you never met this patient before. You don't know anything about this patient. They walked off the street or they came in straight from EMS unconscious. You don't know their HIV status. You don't know why they're here. You don't know if they have an anger management problem. They could just blow at you in a minute. You really don't know anything about them. So at any point in time, anything could go crazy. In the ICU, you know your patient, you know why they're here, you know their vitals, you know their trends. So they could be hypotensive, but you sense that. So when you see everything going down, you know they're gonna code. So you put a crash cart in there. In the ER, we don't know. You come in, we don't know anything about you, and then you code on us, and then we have to grab the crash cart, grab people, grab the doctor, and start a full code right there, wherever they are. So in the ICU, everything's pretty much like organized. They know their patients, they know when they're going to decompensate, the doctor's aware, the doctor's ahead of it, like everything like that. The ER, we don't even know. You could have many other medical conditions and we don't know because you came in unconscious or because we never met you before and we didn't even get a chance to see you yet. So if you're the type of person that likes organization, ICU is for you. If you're the type of person that thrives in chaotic environments, remains calm in chaotic environments, that's important, and likes action and is able to handle multitasking, the ER is for you. Another difference is the documentation. In the ER, like I said before, our goal is to stabilize you. We're literally just documenting the minimum necessary. In the ICU, they're literally documenting a full head to toe. They're also turning the patient every 2 hours, mouth care, everything like that. In the ER, I have yet to see an ER nurse do mouth care for a patient. Yes, we would love to. Yes, that's the best thing for our patient, but we can't. We have 5 other patients. We have 6 other patients. We're literally just treating your emergency, and then that's it. So that means that a lot of times we don't turn our patients. We don't do mouth care. We don't document like we should. But that's just the state of the ER. So all in all, if I was to tell you to go into ER, ICU, if you're very detail oriented and you like to know a lot about like one topic, so let's just say you see the ICU nurse, so then you'll know a lot about cardiac, or you want to learn a lot about neuro, or you want to learn a lot about surgery, then ICU is for you because you know a lot about a little. In the ER, we know a little bit about a lot. We get every different type of patient, from dialysis patient to pediatric, adult, any different type of patient with any different type of disease. And we know a little bit about a lot. We don't know in detail about any disease because we don't have time for that. And we can't know in detail about every single condition that comes in. So those are basically the differences. I love ER nursing because that's what I do. But a lot of my ICU friends cannot do ER nursing, and a lot of ER nursing cannot do ICU. So anyways, I hope that video helps. Please like and subscribe and stay tuned for more. Thank you. Bye.